Hi, I'm Brandy Aguilar. It's Friday, May 22nd, 2009. In this week's Beaker Beat, it's been an exciting 4 days at the 2009 Bio International Convention in Atlanta. We'll have the rundown on who was there and what people are talking about. Does Johnson & Johnson have a secret weapon when it comes to reviving its stent business? And it looks like more life science companies are branching out into the land of tweeting and blogging. We'll have that and more in this week's edition of Beaker Beat.
Confronting reality is the first step to changing it. And it is not just governments that must confront the realities of the AIDS epidemic, it is all of us. With all due respect, it is the people in this very room. Together, we can confront the realities I've described in a number of ways. Let us demand that researchers have the resources to undertake every new investigation of every promising scientific approach. Let us demand that government deploy health advances once proven effective. Let us demand that education programs that prevent new infections among our young people are put into place.
Working together to find a cure for AIDS was a topic of Sir Elton John's keynote address at this week's Bio International Convention in Atlanta. John's AIDS foundations have raised more than $150 million in support of projects in 55 countries. While this was a hot topic, there were several other issues that drew 20,000 scientists, industry leaders, and government officials from 60 countries to the annual convention for all things biotechnology. The 4-day program featured more than 170 sessions, and 1,800 exhibitors were on hand to showcase their latest products. One of the biotech industry's biggest leaders, Stephen Burrell, was also at the convention to give his annual presentation on the state of the industry. He talked about some of the key topics he would touch upon during a podcast on the Burrell Report.
I think they should expect a massive amount of data. I'll have several hundred slides that we'll run through reasonably quickly, making the key points on the structural change, the nature of the global opportunity, the nature of the challenges in front of us, and the answers to many of the questions people have about what do I need to do differently today than I've done before. So we'll try and run through it on a global basis. We'll also deal with the changing nature of the bio-cleantech world, changing nature of agriculture and biology. So it won't just be a healthcare speech, and it won't just be a U.S.-centric set of comments, but we really look at a global opportunity and try and provide some useful guidance to CEOs and others in the industry about the pathway to success.
Next year's convention will be held in Chicago. It's official. Dr. Margaret Hamburg has filled the top spot at the FDA. The Senate voted in Hamburg to be the next leader of the agency on Monday. The Associated Press said one of the things topping the doctor's list will be helping to oversee the development of a swine flu vaccine and an increased focus on food safety. Health and Human Services Secretary Kathleen Sebelius said Dr. Hamburg is an inspiring public health leader with broad experience in infectious disease, bioterrorism, and health policy. Her expertise and judgment will serve the FDA well. Medtronic was keeping reporters busy this week. The world's biggest medical device maker was making headlines on several different fronts. They range from Medtronic stock being at its lowest PE multiple in more than a decade, some new warnings about the wiring of one of its pacemakers, plus all the recent hiring and firings within the company worldwide. Medtronic CEO Bill Hawkins addressed some of these issues on CNBC.
Well, Medtronic's reputation is built on the quality of our products. We are developing and manufacturing and implanting devices, whether it's for defibrillation or for pacemakers or in degenerative disc disease. So we clearly understand and have taken a leadership position in designing quality into our products and making sure that our systems, are robust, reliable, and are safe and effective for people who need them for whatever problems they may have.
Hawkins also talked about the positive studies surrounding its ICD products and working with the new FDA commissioner, Dr. Margaret Hamburg. Johnson & Johnson is hoping to again recapture its dominance of the stent market. If you recall, J&J started the competition years ago by first introducing Cypher as the first drug-coated stent to market. Since then, Boston Scientific and Abbott Labs have both entered the fray, with Taxus and Xience taking a big bite out of J&J's once thriving market share. On Tuesday, the company released preliminary results from a study of its newest stent, Nevo, versus Boston Scientific's Taxus. 6 months of data collected from nearly 400 patients showed that J&J's stent had less tissue growth inside than patients who received a Taxus stent. This news suggests that patients who get the Nevo device may be less likely to need follow-up procedures. While more data is needed, J&J is hoping this will give them the boost they need to become a major force in the hyper-competitive $4 billion market. J&J is reportedly seeking approval for the Nevo device in Europe sometime this year and in the U.S. by 2011. And J&J is also making our M&A file this week. The drug maker has agreed to acquire cancer drug developer Cougar Biotechnology for about $970 million in cash in hopes of strengthening its oncology business. J&J said it will tender to purchase all outstanding shares of Cougar at $43 per share. Cougar is currently conducting 2 pivotal stage trials for an experimental treatment for prostate cancer. This deal makes the latest in a string of purchases by other big pharmaceutical companies for smaller ones with promising products, including GlaxoSmithKline for Stiefel Laboratories. Another M&A notable is Novartis. The Swiss pharmaceutical giant said it will buy the generic injectable cancer drugs business of Austria's EBEWE Pharma for more than $1 billion in cash. Novartis said the products will be incorporated into its own generics unit, Sandoz, creating a new unit in Austria. CEO Dan Vasella said these medicines will remain the backbone of multi-drug treatments in the fight against cancer, one of the world's leading causes of death. Novartis said the market for injectable generics was worth between $10 and $12 billion back in 2008, with cancer drugs accounting for almost a third of that. This deal comes after Pfizer just recently expanded more strongly into generic drugs. You can't go far without hearing about all the latest social media applications taking over the world. And all the hype about blogging and tweeting has more life science companies joining in on all the fun. GlaxoSmithKline is the latest leading life sciences company to launch a new external blog to go along with its Twitter page. Best we can tell, there are only 4 corporate blogs up and running across the industry. However, the roster of life sciences companies on Twitter continues to grow at a much more rapid pace. Roche, Novartis, AstraZeneca, Pfizer, Affymetrix, and Johnson & Johnson have all jumped on the Twitter bandwagon as a channel to distribute press releases and other corporate news. As for GSK, the company said its blog won't be a vehicle for promoting its own products, but rather a place for dialogue on health and healthcare issues. It will be interesting to see which other companies will enter the social media craze in the coming months. Remember to keep on top of all the latest news at Beaker, join our LinkedIn group, or follow us on Twitter at username Chief Beaker. That's going to do it for this week. See you next Friday. I'm Brandy Aguilar with Beaker Beat.